Kelly Sheldon returned from South Africa this summer. As a minor in global health, Northwestern University's program that places dozens of students around the world every year, Sheldon worked to design an application to diagnose fever in low-resource settings. Sheldon said the doctor she worked with was instrumental in implementing this procedure in South Africa.
And so we got to have his feedback, we got feedback from medical students, doctors, and then we also took it into the clinics and had a feedback survey with nurses.
Access to doctors, nurses, patients, and clinics in real time is one of the things that makes the Global Health program so worthwhile, students said.
So at every single clinic, we got to actually go through the questions and the protocols on the patients and kind of see where our application was lacking and where it wasn't.
For students minoring in global health, a term abroad is mandatory. However, many master's level students also participate in the program, with complex projects driven by their own curiosities and talents.
What I did was I helped design an experimental procedure and go through the ethics approval and then help test the actual product to see if it is as effective as current treatments.
Marcy's projects focused on treating premature infants suffering from jaundice by wrapping them in a specially designed blanket, and on designing a breathing aid that would be comfortable and effective without leaving scarring, a problem up till now. The process, he said, required a change in mindset.
It's a way different way of thinking when you're actually there, and you see that your first solution may not be feasible or may not be the best one because it doesn't interact with how things are done.
Anisha Suresh, a master's student in biomedical engineering who traveled to South Africa with Marcy, worked on an easy-to-use home device that could destroy HIV pathogens in breast milk. Her biggest takeaway?
Patience in the design process, and just in general, because it takes a lot of time to really understand what the problem is and all of the components that contribute to what you're trying to solve. So when you go there and you see the problems and you see the devastation, you immediately want to quickly come up with a solution, but it's important to really consider all the aspects.
As well as teaching students the fundamentals of health and design, the Global Health program introduces students to a variety of cultures and countries, sending them to such faraway places as Mexico, Uganda, Chile, France, and China. Recently, the program took a bold step in sending Northwestern's first student group to Cuba in summer 2011. Emily Roski, one of Cuba's first visitors from Northwestern, loved how complete an experience the program provided.
We had various excursions and discussions with people in the medical field and visited museums to get the history aspect. So the program itself was very holistic in learning about the culture of the country as well as the medicine and public health aspect.
Helen Gomez, who speaks Spanish and has family in Cuba, said that the thoroughness of the experience is what makes it so valuable.
Stepping away from the American perspective and from the textbook perspective and being within this culture makes it so that you understand it so much more clearly.
Gaurav Godadia, a senior who will be graduating this year and hopes to attend med school, said that Americans have a lot to learn from other countries, especially Cuba.
Cuba is a place that doesn't have much money, but at the same time, and individuals don't have much money, but at the same time it has some of the best health outcomes of anywhere in the entire world, has better infant mortality rates and AIDS rates than the US even does.
The vast differences between the United States and much of the rest of the world is what makes programs like these so crucial to student learning, said Matt Glucksberg. Glucksberg, a professor of biomedical engineering, has led several student trips abroad, including to South Africa.
Really, it's an education program. This is not an aid program. This is not a mission. This is for our students to learn about another part of the world and how they do things, and what the specific problems are there. And that's what's really useful in engineering, is to understand a different system and a different society.
Roski feels that these interactions were the best part of the program, and the part that will stick with her in the future.
In my future career and future degrees, I really want to emphasize those human partnerships, because I think that's kind of what global health is all about, is working to improve lives.
This is Sarah Moore for the Global Health Portal.